Hi everyone, welcome back. So at the moment, I will be able to put out quite a few more videos, hopefully, because like so many other people right now, I've had to stop working because of places closing due to the coronavirus. So today I am going to be talking about the menopause and how massage can help relieve some of those symptoms. So, we know if you've seen any of my other videos, you'll know that massage can certainly help with various conditions where there is a hormonal imbalance. And certainly when the hormone levels start to become diminished, that can certainly bring about quite a few symptoms. But massage is certainly a very effective treatment option. For me, I had endometriosis, which I will also be doing a video on, and consequently had a hysterectomy at 34 years old. And so by the time I would say I was, certainly by the time I was 39, I was starting to show symptoms of the menopause. But the issue I had, I'm going to list on this video about 33 symptoms of the menopause. Now, I had about 22 of these. But the problem that I had, as I know so many women find, is that sometimes there is a lack of recognition by GPs and also dentists if you have any sort of, dental issues. About the fact that this can be caused by the menopause, and it so often seems to be just put down to, oh, well, you're a bit stressed, or, which was the case with me. And so I actually couldn't even get a blood test done to check my hormone levels, and consequently didn't get on HRT until I was 42, which really, definitely solved most of the issues that I had, but you don't really want to be waiting that long. So hopefully this video will give you a good, clear picture of what the symptoms are, so that you can then sort of hopefully recognize whether this is the menopause, or not. Okay, so symptoms of the menopause. So probably the most well-known one is the hot flushes, which is basically where you get a sudden sensation of like feverish heat, which can be throughout the body or more commonly on the face and just into the chest area. And these affect probably about 50% of menopausal women. Some women will, just feel hotter than normal. Some people, it's like you can literally see a line moving down their face, as they become red, which can make you quite self-conscious when you're out in public. Obviously, another one, irregular periods, due to the levels of estrogen and progesterone becoming unbalanced. Your periods may become quite sparse or just not within their usual regular pattern. Obviously, this is much harder to kind of identify as a symptom. If maybe you've been fitted with a coil, or like me, if you've had endometriosis, and then I had an early hysterectomy, so obviously I then wasn't getting periods at all. So that sometimes is sort of something that you can't use to recognise the menopause. But fatigue, You know, if you're feeling tired all the time to the point where even simple daily tasks are becoming difficult, you just don't have the energy, you know, but there's no sort of specific illness to explain that, you know, and it kind of usually will start to impact on your mood as well as just generally how, you know, productive you are. You know, I didn't probably realise, I think I was so used to being tired a lot of the time from, you know, when I'd had the endometriosis, and, you know, I was a single mum with a disabled child, you know, that kind of became my norm. And really, it was only when I'd been on HRT, and 1 month I couldn't get my prescription for about 10 days. And boy, did I notice then just how tired I had been, you know, because so many of the symptoms kicks back in literally within a week. You know, so yeah, sometimes you just don't realise quite how tired you are. But that's certainly another indicator of menopause. Memory loss. You know, estrogen and progesterone have also been, you know, linked with memory. And so it's believed that if the levels of those hormones are decreasing, it may in fact, you know, contribute to lapses in memory. Another one alongside the hot flushes are night sweats. You know, and I mean, these could just be, you know, you could see these as hot flushes during the night. But, you know, or it could just be, again, just feeling hot. But certainly they can really disrupt your sleep cycle. And of course, if you're already suffering with fatigue, you know, lack of sleep is going to make the problem even worse. Loss of libido. You know, you can become very sort of disinterested in sex. And again, this is really due to the fluctuating levels of those hormones, which, you know, and they can also cause not only depression, which obviously can affect sexual health, but they can also cause vaginal dryness, mainly due to the decrease of estrogen levels. And so that causes the natural moisture in the vagina to diminish, which will then cause many women to, you know, have pain and discomfort when having sex. Hence, you know, they then, you know, just don't enjoy it and become a bit more disinterested in it. So, as we just said, you know, the hormone levels, you know, being out of balance can certainly affect women's mood. You know, you've got those, again, like your feel-good hormones, like your serotonin, which are actually neurotransmitters in the brain. And so if you have fluctuating levels of the hormones, that can actually affect, you know, these neurotransmitters, which, as we know, you know, can influence your mood and depression. And also these neurotransmitters, and dopamine as well as another one, you know, as well as regulating those feelings of sort of calmness, they also regulate the pain and pleasure sensors in the brain. And so if you have an imbalance of these, you know, like the serotonin and dopamine, you know, it can cause erratic mood swings, anger 1 minute, sadness the next, you know, to extreme happiness, you know, and then the next minute you're hysterically crying in a corner somewhere. So, yeah, it really has an impact on mood. And this can extend into almost like a panic disorder, where you can have, more debilitating emotional episodes, where you'll have feelings of dread and panic. You'll, start shallow breathing. You might have a rapid heartbeat. Um, you know, just like having, panic attacks, but more regularly. Another symptom would be urinary tract infections. And this is really, again, the changes in the hormone levels. You're getting that vaginal dryness, and this can also bring about changes in the natural vaginal bacteria. And so when that happens, and the pH changes, you're then, going to be prone to urinary tract infections. And bloating as well, due to the fluctuating estrogen levels. You may find that you get a lot of water retention, which is going to result in you feeling, really full, or possibly, tight around the belly, or, just sort of abdominal swelling. Hair loss is another common one, again due to low levels of estrogen, which is required to keep those follicles nice and healthy. We mentioned earlier about, obviously sort of mood swings and fatigue, and then hot flushes affecting sleep. Certainly sleep disorders is another symptom, whether that be insomnia or some sort of sleep disordered breathing, night sweats. And again, all of this is due to those changes in hormone levels, and also to the emotional stress of the transition. As we know, if you're stressed and, sort of worrying about things, and you're anxious, you're not going to sleep as well. But also, in addition to the estrogen, low levels of progesterone have also been linked, to problems with sleeping. Dizziness. Now, this may just sort of be something that lasts just a couple of minutes, or it can actually lead into, frequent and extended episodes, at which point it can increase your risk of having falls and things as well. So again, it can, it has the capacity to really, affect your day-to-day life. Now, we mentioned about bloating and increased water retention. Certainly weight gain is another symptom. This is usually down to a decrease in the estradiol, which not only affects the metabolism, which, consequently makes it quite difficult for you to lose weight, but it can also diminish the muscle mass and just that lean body mass, which then causes the fat to redistribute, and quite often you'll find that will collect around the abdomen, which, again, for most women is probably the hardest area to lose weight. Incontinence. Now, again, due to the imbalance of these hormones, you also will get a thinning of the urethral walls, which, consequently will probably cause weakness there. Maybe you can't hold, your urine as well as you used to be able to. And certainly if this is a problem, do look at my video on the pelvic floor, because I will talk a little bit about, incontinence in that one too. Headaches, again, due to, reduced production of estrogen. And again, if you're not sleeping well, people tend to be more prone to headaches as well. So one of the things when I started this video, I said about sometimes, symptoms of HRT, of the menopause, aren't always immediately recognised by GPs, but also dentists. And certainly one of the symptoms that I had, which was probably the first one that I really recognised as something sort of out of the ordinary for me, was that I was getting a very metallic taste in my mouth. My gums were becoming quite sore. Now, some people will actually also get like a burning sensation on their tongue, and sometimes their lips as well. For me, I just started getting a very, very dry mouth and metallic, taste with sore gums. And the dentist basically had no clue. He thought maybe I was not absorbing vitamins due to my IBS. Then he sent me off for biopsies, thinking I had Sjogren's syndrome, which, that came back clear. And no one ever did give me an answer for it. And so I believe, that probably was down to the menopause. And again, that has got a little better since, taking the HRT. Digestive problems. Now, estrogen helps keep the cortisol levels low, cortisol being the stress hormone. So if your levels of estrogen are declining, your levels of cortisol are going up. And in addition to the effect on sort of stress levels, this can also slow down the digestion, which again can cause bloating, constipation, and also abdominal pain and discomfort. Muscle tension, most commonly strained muscles around the neck, back and shoulders. Joint pain as well. You'll probably find, just feeling maybe a lot stiffer when you get up in the morning, or maybe, just not feeling as flexible as you used to be. Allergies. Again, these fluctuations of the hormones can really impact on the immune system, which then causes increased sensitivity to allergens, which means, consequently you can end up with, rashes or itchy eyes, sneezing, and even general itching. Brittle nails as well, due to low levels of estrogen, can cause the nails just to become brittle and dry. And again, this is probably to do with, declining sort of absorption of calcium as well, which, as we know, keeps the nails strong. And we know that, calcium absorption is reduced when you've gone through the menopause. Okay, so another symptom, we talked a little bit sort of at the start about hot flushes. One of the symptoms is change in body odour, and can be increased sweating, which again is due to these low estrogen levels. And what happens is, these reduced hormone levels send false messages to the hypothalamus, that the body is actually hot when it's not, and therefore then increases sweat production to initiate cooling. And when you increased, sweating, as well, it's probably harder to control as well. So if you've then got stale sweat, sort of lingering on the skin, again, that's gonna, bring about changes in body odor. So, okay, what else? So we mentioned about allergies and, sort of itchy eyes, and, we mentioned certainly itchy skin all over can also be an issue. And again, this is also down to, when the estrogen levels drop, collagen production in the skin actually also slows down, and this consequently leads to thin, dry, itchy skin, which again can be all over the body. We talked a little bit when we said about the brittle nails, we talked about reduced calcium absorption by the body. And, I think most people are aware that certainly when you've gone through menopause, osteoporosis can certainly be an issue. And that's why it's really important to maintain your calcium intake, to get as much as you can. We know estrogen helps to maintain the bone density. So again, when the estrogen levels drop, you're going to have an increased risk of, weakening of the bone and a decrease in the bone density. Thus, making you more prone, more susceptible to breaks in the bone and fractures and things like that. Tingling in the extremities, so hands and feet, can be a symptom. Irregular heartbeat due to the nervous and circulatory systems being overstimulated, again due to the lower levels of estrogen. We talked earlier about memory being affected, certainly difficulty concentrating, which, it could be partly due to the effect on memory, partly due to mood swings, partly due to poor sleep and fatigue levels, but certainly, a consequence again of those decreased levels of estrogen and progesterone. We've said about sort of the effects on the mood, anxiety, certainly, we've said the estrogen levels cause a drop in the serotonin and the dopamine production, which are those feel-good hormones, those endorphins, that regulate your mood. And, reduced estrogen levels also bring a rise in that stress hormone cortisol, making you feel more anxious. Consequently, also feelings of depression can really kick in. Feelings of sadness that, may evolve into depression, even if you've never suffered with depression. And again, this is due to the reduced production of that serotonin and dopamine. Certainly, if you have suffered with depression, you will probably really feel that definitely kick in, and your mood really will be quite up and down. Breast pain, again, due to the fluctuating hormones. Not everyone gets this, but I'd say, if you're one of those people that tends to get some breast tenderness around the time of your period, then the likelihood is, you probably get it around the menopause as well. Joint pain, we've said about reduced flexibility. You might have a bit of stiffness when you get up in the morning. Estrogen, we know, also helps to manage inflammation levels in the body. So again, low levels of this hormone, you're going to get aching, tingling in the extremities, as we said, tightness around the hips, sore knees, swelling in the joints, all can be signs of the menopause and can lead to arthritis, and plus when you think about the diminishing bone density as well, that can also contribute to joint pain. One other thing I forgot. Yes, there is another symptom, which is not a common one, which is electric shock sensation, which again, due to the fluctuations in the levels of estrogen, can actually cause you to have like a sensation of like having an electric shock. That's not a common one though. So yeah, as you see, the main cause of most of these symptoms is, the fluctuations in the levels of certainly the estrogen and also the progesterone. And these can easily be treated with hormone therapy. But certainly, nutritional guidance, fitness programs can also really bring relief from menopausal symptoms. And if you've seen my video on the mitochondria, and the effects of massage and exercise on the mitochondria, you'll know that after a certain age, production of these mitochondria, which are responsible for glucose metabolism and energy production in the body, they start to decline. So, this is really a good time if you've never sort of really been on an exercise program to sort of start doing some, because it will really boost the production of those mitochondria, which will also help with those fatigue levels and also with the joint pain and any inflammation that you might be getting. And massage also has the same effect in boosting those mitochondria levels. So yeah, but certainly along these things like fitness and nutrition, massage is absolutely a great remedy for a lot of menopausal symptoms. If your menopause is causing you anxiety, irritability, depression, fatigue, we know one of the greatest benefits of massage is relaxation and stress relief. But it's also a good opportunity to just get kind of back in touch with your own body, and to really cultivate a positive body image, because some women do feel, stress even about just the changes in their body. So it can just help you deal with that a little better. Certainly we know improved circulation and lymphatic flow, which is going to help relieve those, headaches and leg cramps, muscle and joint pain, and, general muscle tension. All are going to be helped by, the effect on the circulatory system. Certainly lower back and abdominal massage can be really helpful for relaxing tension and stimulating the circulation around those reproductive organs and the pelvis. Unfortunately, a lot of therapists don't do abdominal massage as part of their full body, which is crazy. But, some of us do, because we do see the benefits in it. And certainly different types of massage, can help, each individual with different needs. For example, an aromatherapy massage could, use specific essential oils, to help promote hormonal balance. As well as, addressing specific symptoms. Certainly things like clary sage, cypress, geranium are really good essential oils for the menopause, and using a sort of even in primrose as either all or part of your base oil, again, is a good hormone, regulating oil. But, do see a qualified aromatherapist. But, the good thing is you can also use, actually, just in your bath, or, at home, a few drops in the bath will really help. Deep tissue massage will probably work best for you if you've got a lot of muscle tension and sort of pain around the joints. If, for example, you've got a lot of bloating, increased water retention, maybe that's causing swelling around the joints, then something like lymphatic drainage will be really good for you. So there's lots of different options in terms of massage. And so what I would say is, as always, make sure that you see someone who is qualified for a start, but also experienced in dealing with the menopause, who, can adjust the techniques being used to suit you as an individual and your specific symptoms. I'm sure you'll find that you'll see the benefits. So that's really how massage can help. The main sort of benefit, as we say, in balancing those hormones out a bit, in promoting relaxation in the mood, easing the muscle tension, and really just giving the circulatory system and the immune system, a bit of a boost. And so that you're not getting sort of overstimulated, like in the hypothalamus, and that then causes sort of more problems. So that's it for me for the menopause. I do have plenty of other videos along the lines of women's health. As I say, I will be doing one on endometriosis. There are also some, if you subscribe to my channel, there are some on postnatal health, pelvic floor, abdominal separation, breastfeeding, all sorts of things. So subscribe to my channel, you'll be notified, or you can see, what else I've sort of got available at the moment in terms of videos. Feel free to comment down below, contact me through my Facebook or Instagram, and I will be more than happy to answer any queries you have. But for now, that is all from me, so I will see you next time. But until then, take care. Bye.